this is Roger Green, host of the Surfing the NASH Tsunami podcast. This weekend, we are offering 5 conversations from episode 16, our preview of hashtag NASH Day, or International NASH Day 2023, and a discussion of why this year this event is so important. Plus, from the vault, a review episode from a previous International NASH Day coverage. This conversation starts with me asking Donna and the group what other issues we haven't touched that might be important or of value around hashtag NASH Day. Donna Cryer talks about the opportunity for large companies, both those in pharma and others, to educate employees on liver health. And GLI is creating toolkits and presentations to help companies educate and engage their employees that way. Jörn Schattenberg notes that another community that would benefit from engagement are family members, since if one family member has disease, there's a higher probability that other members in the family will as well. Pam Danagher talks about the importance of non-invasive technologies in screening and diagnosing patients and developing trial entry pathways as drugs come to market and knowledge becomes more widely held. This leads Donna to talk about her interest in facilitating mobile FibroScan or other kinds of scanning clinics so that we can get more people scanned in the field, the kind of thing that Louise Campbell and Towers and Health do in the UK all the time. Finally, I point out that when NASH has a drug approval, that the amount of information and exposure, both driven by the industry and by public relations and by all communities, will ramp up dramatically so that all of us, every player in the game, needs to be thinking now about how we step our game up. As we get to the end, we wind up talking about the importance of a celebrity patient advocate, and Donna talks about having somebody in NASH who does the kind of work that Bernie Williams is doing in liver cancer. Here at Surfing the NASH Tsunami, International NASH Day has always had a large place in our hearts and a big spot on our calendar. We met Donna there for the first time in 2020. She joined us as a co-host for a while, and we have enjoyed participating in this event and seeing it grow and flourish over time. 2023 will be no different. So sit back, listen, enjoy, learn, and when you're done, join the conversation on our LinkedIn discussion group.
Donna Cryer.
There's one thing that I really want us as a community to dig really deep in, and that is for both our industry partners and for just companies, large employers in the community. We'll be creating particular toolkits with table tents and presentations for people to show their employees. And so we're reaching out to HR and benefits people because we realize that even within companies that are in the NASH space or in the liver cancer space, or often their board, their C-suite, particularly in companies that liver disease is not their only area of focus, that there's a lot to do within all of these companies as employers to raise awareness about NASH. And I think that we would be remiss if we didn't really dig in and pay attention and give a robust effort to ensure that everyone, large companies, certainly every company that it touches the liver space, has the tools to do employee events, including screenings, but definitely including, education and opportunities to give. But that employees, these are people. We know people have NASH. People have family members that have NASH. If we can't even talk to the thousands of people that we work with every day, we would have missed an opportunity. So my hope amongst the plethora of step-up videos, that employers will step up and really take this message to their employees.
Jörn Schattenberg.
Again, I think many things that Donna has highlighted, and I'll hand it over to Pam to detail the company's perspective, is that intensity by which we approach the people living out there and reaching out to them. The example Donna mentioned is through the families. And we know that there's a higher incidence of non-alcoholic fatty liver disease among family members. A, they share the same diet and environment, and B, they share common genes in most cases. And this is just so incredibly useful by asking simple questions. Have you thought about your brother? He might be at risk for advanced liver disease. And that's a good idea. Maybe we should bring him next time. And this type of amplification or of the health message we want to portray here, again, that's to me the big thing about NASH Day. Hashtag NASH Day.
Hashtag NASH Day. I also think that, Jörn, I also listen for tips on format for our materials. I kid my young team members about putting things in millennial font. I was like, can I have this in a size that people over 50 can read? But I think that you give me ideas for some tear-off sheets or something that there is a portion that you can have for yourself, but maybe something that you hand off to your brother, your sister, a family member, or able to share socially as well. But something that spurs a family conversation or referral, if you will, I think would be an important aspect. And so let me get with my Cracker Jack graphics folks and see what they think about that.
Particularly Taros for the booth in the middle of Mainz, huh?
Yeah.
Jörn, you might have to go do this. I might have to run the steps. You might have to do a booth. Pam, what are you going to have to do?
Pam Danagher.
I think, we've raised a number of important points here just from a sort of general public health point of view. Healthy diet, concern about food deserts in certain places, particularly in the U.S. And Donna, you've touched on maybe more routine screening, certainly in high-risk settings, as Jörn has raised. But, you wonder about some of the efforts around developing non-invasive tests that can be used in the first instance to support drug development in NASH, for example, to assist diagnosis for trial entry, and then potentially even for an efficacy assessment at the completion of a trial. But, could you envision a future where there's some simple non-invasive test that, that's just part of your routine screening, right? You go for your, yearly checkup and you're going to have certain things evaluated. And is there a future where there's some simple non-invasive, right? I mean, I don't think anybody wants to sign up for another colonoscopy, for example, but something a little less invasive maybe might be something on the horizon in the future.
I think that there's incredible potential in serum-based tests so that it's just part of your normal blood work. But I would still caution us that right now, a lot of doctors don't pay attention to elevated liver enzymes. And so we need education and maybe facilitation in the order sets or to get them to order the test and to interpret them. Again, communicate that information back to patients. So there's some wraparound activities to even something that seems so simple. I also think that I'd love to have a van with FibroScan in it and be able to do rapid ACV testing and hepatitis B testing and just a liver health van and able to do some FibroScan in it. So Roger, you shouted out to me. Let me shout out to EchoSense about our interest in really bringing, liver health screenings out to communities and integrating this into community health fairs like other types of testing are, and really make it hard for people to avoid. I want to go beyond easy for people to reach and make it hard for people to avoid liver health screening. We need, there's a lot that we can do to bring this to people that we can continue on. That is the continual challenge beyond NASH Day. But I hope we can give some great examples of that on NASH Day to show.
You make an interesting point. And when I heard the theme being Step Up to NASH, one of the things I thought about is that we haven't really been pushed to do that because in the absence of drugs, lots of people just aren't going to pay the attention they need to. If, as we all hope, drugs become approved, then we're all going to have to step our games up because we're going to have patients who want to do more done, doctors who want to do more. We'll start to see advertising from drug companies that will force everybody to become more knowledgeable. We're going to have a whole bunch of patients fall through the cracks in horrible ways that haven't happened yet. So my challenge to everybody around this event and that theme would be to ask, what can you personally do to step up? Once I get to the top of the Rocky statue and I catch my breath again, what can each of us do really to step up our game so that we help educate consumers so that when they hear from their doctor, you've got fat on your liver, but nothing to worry about, that they convert themselves into activists and patients instead of just going away and saying, okay, that's fine. And then hearing 20 years ago, like a Terry Milton or a Tony Vigliotti or a Wayne Eskridge, that you have to have a liver transplant because we never told you at the time. But, like half the people who've learned for the first time when they're decompensating in an emergency department. The theme is really fantastic. And the call to everyone to step their games up is really important. And I just wonder if we missed anything on that before we let you go. You're 2 minutes past when you said you had to be out of here.
Donna is leaving soon, so I'm going to shout out to her with a second idea. And we still need the celebrity. I think we've discussed that idea sometimes. We need somebody who steps up and says, I'm affected. Somebody who has a broad reach to the public. And if anybody, you can find it, Donna. So him or her.
I am actively asking. I think, frankly, that is one of the things that having a drug on the market and companies, our industry partners can help me do. GLI does not have a celebrity budget, but we can make this a safe, destigmatized place for a public person, a well-known person to come and join us. I think that we certainly know that there are well-known people who do have NASH, who must have NASH. I'm sure there are many AASLD members whose patients they are. So I would turn this around and ask, or EASL members, so I would ask the physicians, are you talking to your celebrity patients and encouraging them to step up, knowing that my team at GLI, and I'm sure other advocacy organizations, would treat them well, would treat them with respect, would cheer for them and counter any negative. I dare somebody to say something negative about a celebrity who comes and steps on board for GLI. Bernie Williams has been a fantastic, legendary baseball player, has helped us in liver cancer to great acclaim from his community, all of his communities, music and baseball and sports. And so I think we have, with that demonstration, if nothing else, people should come on board. Liver patients deserve to have somebody to stand with them the same as other patients. We are wonderful, wonderful people. And so we would welcome a celebrity in our midst.
Looking for a celebrity to step up, huh?
Yes, we're looking for a celebrity to step up.
So we got companies that need to step up, celebrities that need to step up. Before you go, anyone else that needs to step up besides like the world at large?
Oh, yes. My goodness. But that's why I took this week off. So I would breathe and maybe in a calmer tone tell a few people how they could step up, particularly those who make comparisons to other advocacy communities without appreciating all that the liver advocates have done. So if anybody wants to step up to support the visibility and viability of this community, we welcome them.
As you know, we first had you on for our 9th episode almost 3 years ago, 174 episodes ago, to talk about International NASH Day. So we're just waiting to hear what the call is for us this year. Happy to do whatever you need us to do.
You have it. Step up.
Okay. Step up. Okay. Donna, thanks. I'm going to let you go. Keep these guys for another couple of minutes. Okay. Take care and have a week of peace and harmony so you can ask people to step up big time.
And now, back to Roger.
We hope you've enjoyed this recording. If you have any questions or comments about the content of this conversation or the entire episode, please put them in the review section of the page from which you downloaded this conversation, or send an email to questions@surfingnash.com. If you want to participate in Global Liver Institute's International NASH Day 2023, you can reach out to GLI directly or to us the same way, and we'll pass your information along. Next week, we will be celebrating Surfing the NASH Tsunami's 3rd birthday and our recent topping of 150,000 total Buzzsprout downloads. It should be a great event. We'll have interviews and old friends joining us, so you're not going to want to miss this. So till then, stay safe, surf on, and we'll see you next week for the party. Bye-bye now.